And today you are attending a protest sponsored by MoveOn.org, is that correct?
Yes.
And what's the purpose of that protest?
The purpose of the protest is to back a strong healthcare option on health for everybody, a public healthcare option.
What do you think the most important components of that option should be?
The availability to everyone, an option for choice, and it needs to be ready and worked out before it's made available to the public.
What do you think is most important about the aspect of choice? What does that mean?
Well, I think people need to, a lot of people are afraid that they're not going to be able to use their own doctors, that they're not going to be able to get the kind of services they want if we have a public option. And I think if they're given a choice of staying with the commercial health care companies or taking this program, then they'll be more likely to accept.
So you think people should be able to choose
between a commercial health care program and a government health care program?
Well, some criticism that's coming from some sides of the argument say that the public option may reduce some of the choices available to individuals who have perhaps private coverage. What's your feeling on that concept?
I think it'll provide basic coverage for more people. And if people want services that aren't covered by the option, then they can pay for them. My brother lives in France, and he talks about the healthcare program over there, and it is just so far superior to what we have available, even through our insurance companies here. The basic healthcare that people have, they don't cover plastic surgery. They don't cover LASIK eye surgery. They don't cover things that are a choice, but they cover everyone's needs, and I think that's important.
One of the issues that is being discussed in the healthcare debate centers around the cost of providing plans. There are lots of proposals, I'm sure, if you've read, that address the cost issue, some of which include taxes on employer-based benefits that are currently offered. What is your feeling on the taxing of employer-based benefits, or really in general, or any kind of taxation that might be required for the health care?
I'm not real sure I have an opinion on that. I know that the cost of health care per capita in the U.S. is more than twice than the per capita cost in the other developed nations. And the outcome is not as good. Our outcomes are, if you look at life expectancy and infant mortality, which is what I've been particularly interested in, our outcomes are lower than 37 other countries, and those countries don't just include the top nations of Europe. They include Luxembourg. They include islands in the Caribbean, small countries, and there's something wrong with our system if it's costing us twice as much as the average for health care, and our outcomes are not as good as 37 other countries. And this is via UN data. This is not MoveOn data. It's not American data. It should be non-biased.
On to the issue of cost, and I think many people have come to the realization that if we're going to have coverage for everyone, that may mean that some of us have to pay more to provide that. What is a number that you think is reasonable for an individual? If we all have to, if the goal is to provide for everyone, what is a reasonable number, do you think, that individuals can be assessed to attain that goal?
Well, thinking in terms of my family, currently under a group plan, we're assessed almost $500 a month for health care. And that's including a lot of profit for the health insurance companies, and no competition on the drugs and that sort of thing. guess I would say that if we were assessed maybe $600 a year per person, that's a lot, because there are a lot of people that can't pay anything. But maybe an average of $600 a person a year.
And do you think that money should come from some sort of income tax? Where do you think the dollars ideally should come from?
For folks that are already paying for health insurance in a public option, that's a great reduction for them. For folks who don't have an option now, I guess it would have to be based on what kind of income they have, and some of that expense would be spread through taxes to the rest of us.
So you think, as far as pricing for a public option, it should be $600 a year for someone to be on the public option? Is that what you're saying?
Yeah, I haven't done any kind of research. I'm just basing that on what we're already paying.
Do you pay for all of your health insurance? Do you do that on your own, or is that part of that paid for by your employer, or is that?
No, it's not partially paid by. Well, it's through my husband's employer. I don't know whether the employer pays part of it. They used to pay all of it for the whole family, but that's long gone.
Well, I think that's primarily the majority of the questions. Is there a statement that you'd like to make as far as what you'd like to see happen with the proposed options that are going to be debated in the coming weeks?
I'd like to see health care available for everyone in this country, basic health care available. And people shouldn't have to go to the emergency room because they can't afford a doctor. And doctors shouldn't have to have huge staffs because they have to bill to so many different places. Although if you leave the choice of private health care, that will continue at least for a while. So I guess that's what I have to say.
Very good. Thank you very much.